Yes, ma'am.
Okay.
Yes.
That's fine.
Right. Started the timer, and here is the question. Right. So if you've read and understood, kindly begin your communication station. Begin with presenting yourself and then.
So which part am I doing and which part is my partner doing?
She is your patient. You are the exam candidate. So you can present. I'm one of the exam candidate. May I talk to Martin or whatever? You can confirm the name. That's how we do it.
Okay.
Or you can ask, what is your name and age? Yes.
Okay. Okay, good afternoon. My name is Fatmata. I'm one of the surgical trainee. May I please confirm your name, please, and age?
My name is John, and I'm 32 years old.
Okay, hello, John. How may I help you today?
You see, I've been asked to come today to the hospital because I'm going to, you see, I have this pain in my knee for which I'm going to be operated on today. So I'm waiting for that now.
Okay. Which part of your knee, please?
Well, I've come to the doctor last week, and he told me that I had a tear in my left leg, left knee, and he asked me to do this procedure called arthroscopy. I've come to do that operation today. So will you be starting anytime soon?
Actually, I can't say much about that. I will have to consult with my consultant to let you know what time we're starting.
So we'll be so we'll be having the operation today. We will be, yeah.
Yes, that I have to confirm with my consultant to let you know. I don't have much idea about when we're starting the operation. That I have to confirm with the consultant, and then I will let you know.
Okay, can't you consult
Is that
with him
okay
now
with you?
and see if I can have my operation now?
He might be busy in theater, so you will have to give us a bit of time to talk to him and then get back to you.
But this is emergency,
okay?
Doctor. It's hurting. My left knee is hurting. This is emergency.
I understand your but so I'll get back to him. But he's in theater, then I'll get
Can't you
back
call
to
him
you
now?
if that's okay with you. Sorry, ma'am. Because he's busy in theater doing a surgery, I won't be able to get him on phone. But if you can
Okay, can you do this? Can you do this then? You see, I'm getting hurt. You know, I don't want to cancel my OT or anything. I need it to be done today. So, and it's hurting me. Can't you do this?
Ma'am, I am a surgical trainee, and then it's not in my for me to do any surgery on my own. I have to do it with my consultant. So if you will give me time to talk to him so that he can book your surgery, and then I'll let you know.
Then I want another consultant to do it then. I want it today. I need another consultant.
Ma'am, I'm sorry about that, but I will just have to get back to my consultant to give you a date on that.
So you're telling me that my operation will be today?
No, ma'am. I'm sorry about that
What?
because
No,
I don't.
you did not.
Am I what?
Wait, my
Sorry.
operation won't be today? So you're telling me that I won't be operated today? It's hurting me, you know, my destiny has been troubling me a lot.
Yes, ma'am. I understand that your knee has been hurting you, but it's like I'm not the one responsible for the operation list. That's my consultant's duty. So therefore, I'll get to my consultant and then I'll let you know. I am so sorry about any inconvenience, but I'll get back to you as soon as he's done from surgery.
Okay, then could you give me another date then? How soon can you give me that date? Should I come tomorrow?
I'll confirm with my consultant and then we'll get back to you as soon as possible.
So you're telling me that my operation won't be today and I'll have to spend a few more days with this bad knee. And so if the operation does to take place the next time, then you promise that it will be not rescheduled anymore? Because you see, I have already, this is the second time I've come over here, okay? The last time also, it got canceled because of certain emergency that popped up. And again, today I had to face this. So you're telling me that the next time I come, do you promise that the next time I won't be postponed?
I'm so sorry. I can't promise that because when we have emergencies, we have to do the emergencies first before any elective case. So I am so sorry about that. I have to.
But sorry, wouldn't suffice because you see, I am taking leave from my work. I work as a guard, and I have to take leave every time that the operation date comes up. So now, what about today being postponed? What am I going to say to my employer? I'm working here, right?
Ma'am, I'm so sorry, but as soon as my consultant gets from the theater, I will let you know as soon as possible. I'll give you a call.
So what about my knee, about this knee pain? Could you do something about this knee pain? Meanwhile,
yes,
tell about the sick leave.
Maybe we can.
Sick leave, you can.
Okay, we can, ma'am. We can give you a sick leave so that we take a break from work, and then we'll so that you'll be able to see your GP and you'll be on medication until we call you back. Is that
and
okay?
what about the pain?
Yes,
I
ma'am.
think that'd be fine. What about the pain that I'm having right now? You see, it's extremely painful, and I cannot walk. I cannot do my work.
Yes.
Okay, ma'am. We can refer you back to your GP to be on medication for the pain, and then we'll call you back as soon as possible if that's okay with you.
Okay. Okay. Actually, another thing, I have been previously prescribed a certain medication for this pain, and I was taking this all this time, but I feel like I'm having heartburn. So are you going to prescribe me the same one? Because then don't.
Ma'am, I'm stuck there.
No, don't be stuck.
Okay, go on.
Change the medication, add antacid.
Don't.
Yes.
Okay.
Yeah. Apologize.
Okay,
Show
ma'am.
your sincere. Yes.
Ma'am, I'm so sorry about that. We'll have to change your medication from an NSAID to something that is gastroprotected, that will protect you
do something else. Yes.
from diclofenac. Yes.
Okay.
Yes, ma'am. And then we'll give you antacid. Antacid for that. We'll give you maybe omeprazole to help you.
Very good. Yes.
Is that okay, ma'am?
The patient still wants to
that'll
complain.
be fine.
So you have to give them the
But you know,
complaint form.
Okay, ma'am. We have a complaint form at the desk, which you could fill for any complaints that you have, which I will forward to my seniors. Is that okay with you, ma'am?
Yes, thank you very much. That will be fine.
Okay, ma'am.
Thank you.
Pleasure, ma'am.
Thank you, Dr.
Anything else, ma'am?
Yeah. You can
I'm
say
so
I'll
sorry,
leave
Dr.
my number.
Fatimata.
Yes. Yes, Dr. Fatumata, it was good. First time. You got little
I'm
because
extremely sorry
It
being
was
so
terrible. It was
rude.
terrible.
no, in real life, patient will be more angry and frustrated.
I'm so
You-
sorry. I was so rude.
No, you weren't. You were right. You were
so
good.
And I was like, I don't even know what I'm saying. She's so good.
It's her first time. That's why, you know, she got little confused, but that's
It's
all right.
okay.
It was a male.
Thank you.
So once you're presenting, you have to remember what you have read outside on the stamp. If it's the male or a female that you're going to, if it's a male, you can say, sir, even if you're hearing a female voice, because we're
Voice,
pretending,
okay,
we're
okay.
practicing. Okay. So
I
it was
forgot,
a male. So
Sorry.
you would
Yes.
say, sir, sir. And in the beginning, like when she told you that I have injured knee and all that, you should
Okay.
have, because you were nervous, you forgot. Otherwise, you knew, you remembered later on. You should apologize and say, I'm really sorry to hear this.
Yes, yes.
Yeah, these
Yes,
sort
I should.
of concerns, showing comments. And
Yeah, that's right.
then,
Keep saying I'm sorry.
yeah,
Like keep
I'm really sorry
apologizing
about that.
every.
Yeah.
Okay. That's
And doctor, you have actually, you have been sent by your consultant to talk
Yes.
to the patient. Okay,
Yes.
so don't say things like my consultant knows. My
Will
consultant
decide.
knows.
Yeah. Because it has already been decided. I'll tell you again. Look, this arthroscopy which was planned, it has been cancelled twice, and again today it is going to be cancelled. Why? Because your consultant is busy with this new arrival.
Yes, yeah.
So consultant is not there. Consultant has sent you to meet this patient and confirm name and age and tell that that you
Yeah.
this is not going to be today.
It's happening. Yeah, that's
Yes.
right.
So you can't
That's
just say that my consultant will tell you
Okay.
what time. You will just say, I'm really sorry to announce this bad news that if we won't be able to take you today. So whatever Dr. Ulfa said, okay, give me a new date and why don't you do it? And your answer here was absolutely correct that you are just junior. You are not authorized to operate on these procedures on your own. So that answer was absolutely correct.
Okay.
And time consuming, you said that was also good. She demanded you to promise and you said that I cannot do. That was also very good. She complained that because of this she has to take leave from the work. Okay, we told you that you can ask to arrange sick leave. And then when she was still complaining, then you could have, like, in 2-3 sentences say, okay, I'll arrange for a physiotherapist, this will ease your pain. She again complained of the heartburn. Then you again suggested, okay, we'll remove diclofenac, we'll add a new medication, and we'll add omeprazole, like you said. So that's very good. So 1 or 2 times you'll practice, and hopefully I'm damn sure it will. Yes, it will be perfect, like anything.
Thank you so much.
At the end, when you have given her the forms, then you can say, okay, I'll leave my number with the nursing staff, and if there is anything more, you can get back to me. So this should be like the ending sentence.
Okay.
It was your first time.
So
See,
much.
everyone is saying.
I appreciate it. Thank you.
He is inpatient, Dr. Ahmed, but he is in OT expedition sent. And still there will be many other patients, and still you have to confirm if you're talking to the right patient.
Right person, okay.
Yeah.
Okay.
Now I'm answering Dr. Ahmed here. So.
Okay.
Yeah, Dr. Ulfat is professional.
I was scared that I'm being too rude.
No, not at all. In this one,
then I had to.
Yeah, you did the right thing.
This is angry patient. This is the angry patient station, and you did very right.
Very well.
You
did so well.
Very well.
Yeah, and you too, Dr. Fatumata, considering it's your first time you're speaking.
Considering it's a first time.
Yeah, you should practice more, and it's easy. It's easy.
Well,
your English is good. That's why it's easier for you, so you can practice more.
Thank you. I will.
Yes,
thanks
thank
a
you so
lot.
much.
Thank you, ma'am.
Dr.
Thank you, Dr.
Abhishek,
Fatumata. Thank
why
you.
not to give some feedback?
Yes, ma'am.
Yes, please.
She really did great. But Dr. Fatumata, as it's your first station, like at the first, from the very beginning, I think you got some blank thoughts, like how
Yes.
would you start? I'm just giving you some ideas, like it's a patient counseling station. Whenever you enter the hall, you'll just see the patient after
Okay.
seeing the notes and everything. Whenever this starts, at first you just check the identity, like the history and clinical examination station, and after that you will ask, like after this checking the identity, you just give a brief idea, like I am here to help you today, something
Okay.
like that. So, but at first, can you please tell me how far you know about your
Okay.
situation? Then the patient will just guide you. Trust me, everything the patient will utter, and you already know the station. And about the patient's content, you will just go through the direction.
Okay.
That's it. Okay.
Okay.
Like you are saying, okay. So at first, according to this type of station, like whenever there is some breaking bad news, here it is breaking bad news that her operation will not be happen today. You just first you say this. Like at first you just say this. Okay, your my consultant is really unable. Don't say that my consultant will not do your case today. Just say like this, that he is really unable to do your case today because he has called, because of has an emergency arrived. So whenever there is, this operation can be cancelled anyway. So this is the basis of your starter. Okay, why this operation is not going to happen? What is the problem? Can you do it? So I call your consultant, something like that. You will just tailor the patient towards the same direction. Like my consultant has been gone away for another emergency care, and we are not able to do the operation. Other than that, everything was all right. Yeah, just some
Thank you so
tuning
much.
you need. Yeah.
Thank you.
Ma'am,
Yes,
another from Dr. Abhishek's
Yeah.
this thing I just remembered about that another point about another consultant, right? So there are a few other stations where they ask another consultant. I'll take another consultant, or I'll go to another hospital, something like that. And
Yes.
what you have to say is that if you go to another hospital, or if you prefer taking another consultation, a new consultation, then you'll have to start from the scratch.
The beginning.
Then it will be more time consuming. So you have to make the patient emotionally play with her and say her that if you know you are going to take another, then it will be more time consuming.
More time
and you don't want that. So tell her like that.
Yes.
Like
Okay.
that.
Okay. That's right.
First, with the patient, you have every right to choose your consultant and choose your
Consultant.
hospital.
That's true.
Yes. Yes, he or
Then
she
you
has
go like,
every
but
right.
personally I feel that if you take another consultation, then ma'am, it will be more time consuming for you, so it will be best if you take like this, just warm up to her.
Very good.
Yes. Thank you so much.
Thank you all. Thank you so much.
I hope you'll book for the practice for more stations in future as
Yes,
well.
I will for sure.
Good. This will help you, because this will take your
indeed.
fear away.
Honestly.
Yes. We don't have any cameras turned on, so it's just recording. But once you hear your own voice, it gives you confidence. And one simple practice strategy I would want you to practice at home: look at yourself in the mirror and then practice. This will, or record yourself and then listen and then correct yourself, and this will also give you confidence, and it will also boost your confidence and enthusiasm.
It feels so embarrassed to listen to my own voice, ma'am. Trust me.
In the beginning, it
what
goes for me as well.
With people.
In the beginning, but then you overcome that. That's what you want.
That's right. Sure. Yes, I'll do that.
Ma'am,
I'll do that.
Can I answer Dr. Ahmed?
Yes, please.
Dr. Ahmed asks about name and age.
Yes, I told him.
The thing is, the thing is about counseling, and when you're talking to patients, if you know the name, and age is irrelevant, but if you know the name, then it becomes a more, it's relevant, and you have to talk like Mr. John, I'm sorry, Mr. John. After a little while, you have to add the name to personalize it, and it's relevant. That's right. So that increases the communication skill.
Yes, and Dr. Ahmed, sometimes it happens that you book two people with the same name but with the different ages for maybe different procedures. One is for inguinal hernia and other one is for ingrowing toenail, and that one you have to know the name and the age as well, and both of them are sitting and waiting in the pre-op room or the OT expedition, and you have to call them in. So you have to confirm that you take inside the right person, not the hernia patient or the ingrowing toenail one. So that's why it's important. It had happened here. One person had ingrowing toenail and one had the tumor or something. So that needed to amputate the foot. So doctor was drunk, didn't confirm that patient was which, and instead of ingrowing toenail, amputated the foot, because patients had the same name but age was different. So same name confusion, didn't check, something happened. Who paid the cost? Patient. So that's why these measures are made, that you confirm name and age before you call them in or convey them the message. Yeah, this is postponed, but you don't want to postpone a patient who is already booked and will be going in. So that's why you have to confirm. So you don't give the message of postponing the operation to the wrong patient. Yeah, good, cool. Now he heard it. All right. Yes. Any more discussion on this? This is very common one. Arthroscopy comes a lot. Yes. Thank you so much, Dr. Anna. Yes, it comes a lot. That's why I thought it would be easier, and it's lower limb and it's part of it. So it covers. Does anyone else want to add anything or say? Good. Thank you, Dr. Fatimata, if it helps you. Yes, should we move on, Dr. Muhammad Al Tahir, if we can have your